you've had a cervical fusion, be aware that with time, that stiff segment can lead to excessive motion above and below. And when that happens, sometimes it leads to a second or sometimes even a third fusion. So what I want you to do is think of a couple of things. Number one, don't force motion in your neck. Use what you've got in a comfortable range. Number two, find a physical therapist who can help to locally restore segmental motion above the fusion and below the fusion. That would be all the way to the mid-thoracic spine, as well as restoring motion in your shoulder girdle. When you raise your arm, you have rotation forces through your cervical spine, and so a stiff shoulder will increase those forces and cause that hypermobility earlier than we would want it to be there. Thirdly, work with a physical therapist to create intrinsic stability strategies for the neck and trunk, and to learn strategies of motor control for optimal movement patterns to decrease loads in the cervical spine.